Hello everyone, I am Dr. Anuj Chawla, and today I am going to talk about an acute lateral ligament sprain and management, as well as briefly about the lateral ligaments. So lateral ligaments are the most common, or an ankle sprain is the most common ligament injury that happens in the foot and ankle region. It happens as a result of inversion sprain. The ligaments most commonly involved are anterior talofibular ligament, and second is calcaneofibular ligament. Posterior talofibular ligament, which is the strongest, is the least commonly involved. So if a patient who has a history of twisting, an inversion injury to the ankle is there, and then you would have to examine the patient. So if you look at the ankle, most of these patients would not have tenderness around the lateral malleolus, but they would have tenderness in the ATFL or in the CFL distribution. So if we look at this model, so ATFL originates a centimeter above the tip of the fibula. If you have tenderness around that region, and it goes horizontally over the talus, so if there is tenderness around this region, the patient might have an ATFL sprain. CFL originates from the tip of the fibula, goes downwards and inserts onto the calcaneal tuberosity. So if a patient has tenderness at the tip of the fibula, he might have a CFL sprain. Apart from that, during the acute setting, you can also look at the Ottawa ankle rules to see whether the ankle x-ray is needed or not. And if the patient has minimal pain, then you do an anterior drawer test to check for ATFL ligament insufficiency and varus stress for CFL insufficiency. The ultimate management for this patient continues to be RICE, which is rest, ice, compression and elevation, to be supplemented by some form of protection, which can be a brace, a cast, or a walker boot. Thank you very much.